Welcome to IM Updates. This is Yan. In this episode, we'll cover key international guideline updates, new FDA approvals, and real clinical changes in practice from April the 24th to May the 1st. Here's the overview. On April the 25th, the European Alliance of Associations for Rheumatology published the updated recommendations for physical activity in people with inflammatory arthritis and osteoarthritis. For sedentary behavior, there is separate emphasis that reducing sedentary behavior has health benefits independent of physical activity level. For physical activity dose, any bout counts. Even short exercise snacks are beneficial, which is aligned with 2020 WHO guidelines. Specific behavior change techniques are listed, including self-monitoring, goal setting, action planning, feedback, and problem solving. Wearables and digital tools recommended for assessment and intervention. There are no disease-specific contraindications, and adaptations should be based on current status. Exercise domains are also broadened to muscle fitness, including power, endurance, and strength. On April the 28th, the Heart Failure Association of the European Society of Cardiology published a clinical consensus statement on evaluation and management of recent onset cardiomyopathy in the current era of heart failure therapeutics. Recent onset cardiomyopathy is defined as newly diagnosed left ventricular systolic dysfunction of non-ischemic, non-valvular, non-congenital etiology, with estimated onset less than 6 months from diagnosis. It is not a new cardiomyopathy phenotype, but a time-sensitive, potentially reversible clinical framework to guide early diagnosis and therapy. Management is based on two prognostic axes, potential for left ventricular reverse remodeling and risk of sudden cardiac death. Early and rapid initiation of GDMT is critical. ICD, CRT, catheter ablation, and M-TEER can also be useful in certain situations. On April the 28th, the International Niemann-Pick Disease Alliance and the International Niemann-Pick Disease Registry published 2025 Consensus Clinical Management Guidelines for Niemann-Pick disease type C. The most significant change compared with the 2018 guideline are two new disease-modifying therapies. Levocetirizumab is recommended for all patients with neurological symptoms, and arimoclomol is recommended only in combination with miglustat. Combination therapy of distinct mechanisms of action is explicitly recommended. Biomarkers assessment is now the definitive first-line test. 3 classes are validated: oxysterols, PPCS to lysoSM ratio, and bile acid metabolites. Philippine test is relegated to resolving uncertain genetic cases. For clinical classification, a 5-category age-based system is adopted for better prognostic correlation. For severity assessment, it endorses the shorter 5-domain NPCCSs, which includes speech, swallowing, fine motor, ambulation, and cognition, as the standard for clinical trials and routine monitoring. The new guideline also adds recommendations for IBD screening, HCC surveillance, and drooling management as supportive care. Move on to new FDA approvals. On May 1, 2026, the FDA approved vepdegestrant, a heterobifunctional protein degrader for adults with ER-positive, HER2-negative, ESR1 mutated, advanced or metastatic breast cancer, as detected by an FDA-authorized test with disease progression following at least 1 line of endocrine therapy. FDA also approved the Guardant 360 CDx as a companion diagnostic device to identify patients with breast cancer with ESR1 mutations for treatment with vepdegestrant. Median progression-free survival was 5 months in the vepdegestrant arm and 2.1 months in the fulvestrant arm. Objective response rate was 19% and 4% in the respective arms. Overall survival was immature with 16% of deaths in this population at the time of the progression-free survival analysis. The prescribing information includes warnings and precautions for QTc interval prolongation and embryo-fetal toxicity. The recommended vepdegestrant dose is 200 mg, taken orally once daily with food until disease progression or unacceptable toxicity. That's all for today. Enjoy your weekend and see you next week.